Hi guys, Assalamualaikum. Welcome back to another episode of Happy Chirp. Today I'm sitting in my new Pakistan studio because I'm here in Pakistan these days, and we've made this new little setup in my house just like the one in Dubai. Today I have with me on the podcast Zara Maqbool. She is a mental health professional and I've had her previously on the podcast. Today we're talking about multiple topics all related to mental health, of course, and I'm sure that they will be very useful for you, so keep watching. Without more delay, here's Zara. Hi Zara, how are you?
I'm good, thank you. How are you?
I'm good. Welcome back to Happy Chirp again.
Yeah, thank you. It's nice to see you after some time.
Yeah, nice to see you too. People like what you have to say on the podcast. That's why I keep having you over and over again. I think you have created a lot of awareness among my audience, and they've told me that in the comments. So thank you for doing that. So today, what I feel like I want to talk to you about, and you recently wrote an article about it as well, was how carelessly mental health jargon that is supposed to be used by professional is being used by Gen Z and millennials as well. I think from a time when there was no awareness around mental health, now it's just in trying to create that mental health, the words, the knowledge is being used recklessly. So you talked about that in your recent article. What are your thoughts on that?
I think, how you started, the word carelessly, that's exactly what's in my mind that, where I think it's amazing how Pakistan is becoming more aware of mental health, and you see this, for example, the Gen Z that we're talking about, or the millennials, are like the new generation, which is more aware of mental health. They are more responsible about it. They are talking about it, and we need these conversations to sort of minimize the cultural shame which is attached to seeking help. We're talking about, I'm not doing well and I need to reach out to the professional. Iska jo it's sort of like I don't know what's the exact word for it, but my fear is that in this inquiry that they want to have within themselves, and this enthusiasm towards mental health awareness, there is also a sense of irresponsibility that this generation, I don't want to just put this generation, like I don't want to label कि सिर्फ न्यू जनरेशन की ये चीज़ है, लेकिन ओवरऑल जनरली जिन लोगों को अवेयरनेस आ रही है मेंटल हेल्थ की, वो कहीं ना कहीं एक्सपर्ट भी इस चीज़ के बारे में बन रही हैं. और बहुत सी पॉप साइकोलॉजी की भी आपने कल्चर देखा होगा कि सोशल मीडिया पे बहुत सारी कोट्स हैं, टर्म्स हैं, सो वो कहीं ना कहीं से बातों को, जैसे आप कहते हैं ना, यू ग्रैब अ फ्यू कॉन्सेप्ट्स एंड देन यू यूज देम इन कॉन्वर्सेशन एंड यू बिकम एक्सपर्ट्स ऑफ सॉर्ट्स. एंड सो आई हैव सीन दैट क्वाइट कॉमन practice that's happening. I see that when many clients who come for the first session and have already declared that my spouse has NPT, which is narcissistic personality disorder, या मुझे पता है कि मुझे depression है, and then so much of my work in the initial few sessions is to challenge this self-diagnosis that they have of themselves or their partners or spouses. So इसका नुकसान काफ़ी है, क्योंकि इसमें फिर जो लोग थेरेपी की तरफ आना भी चाहेंगे, वो कहीं ना कहीं उनको लगता है कि they're being shamed, or they're being diagnosed,
right,
and they are being treated as a patient. And that's the risk which will counter this movement that is taking place right now.
I think it's very ironic, because the reason that we started talking about mental health in the first place was to rid people of the shame and sort of taboos attached to it. And now we're seeing the same happen because of overusage of the same.
Bilkul.
So in what ways do you think it's particularly I don't know, for the lack of a better word, dangerous to be doing this?
I think it's like we were discussing before, I'm trained as a therapist, right? So I don't have a medical background. I am not trained to make this diagnosis. So when clients reach out to me, so many of them refer to me as a doctor, and so the expectation is कि मुझे भी इन diagnosis के बारे में पता होगा, जो कि of course मुझे इसलिए पता है कि मेरा फील्ड है तो मैंने पढ़ा हुआ है, लेकिन वहाँ एक जिम्मेदारी की बात आ जाती है, और मैं जहाँ मुझे लगता है कि कहीं ना कहीं कुछ सिम्टम्स हैं, आई रेफर देम आउट टू अ साइकेट्रिस्ट. डेंजर ये है कि पाकिस्तान में क्योंकि रेगुलेशन नहीं है, फॉर एग्जांपल जो एंटी डिप्रेसेंट्स हैं वो आपको कई दफ़ा प्रिस्क्रिप्शन के बगैर भी मिल जाते हैं पाकिस्तान में, और फिर आपकी ड्रग एडिक्शन स्टार्ट हो सकती है टुवर्ड्स मेडिसिन. सो उसकी जिम्मेदारी कौन लेगा? अब अगर आप फॉर एग्जाम्पल अपनी किसी फ्रेंड को लगातार कहें कि मुझे पता है कि तुम्हें डिप्रेशन है या तुम डिप्रेस लग रही हो, मेरे साथ भी ये हुआ था, इवन इफ द सिम्टम्स लुक द सेम, शी माइट नॉट हैव डिप्रेशन बिकॉज ऑल दिस क्लिनिकल डायग्नोसिस इज अ प्रीटी grueling process. So even a psychiatrist is not going to make that diagnosis based on a few symptoms and hand over, although some do. अगर वहाँ उनकी प्रोफेशनल एथिक्स आ जाते हैं तो नुकसान ये कि ये जब आप डायग्नोसिस ऐसा करते हैं जिसका कहीं ना कहीं एक मेडिकल ट्रीटमेंट भी है, फॉर एग्जांपल डिप्रेशन का है, एंजाइटी का है, आपके हार्मोन्स ऊपर नीचे हैं, आपको दवाइयाँ दी जाएंगी, तो then you are who's going to take responsibility of the person who starts trying them? And then you don't know, एक mental health is a very complex field, right? Psyche इतनी complicated है, तो जिसको डिप्रेशन है उसको हो सकता है कि suicidal tendency भी हो, सेल्फ हार्मिंग हो, या उसमें एडिक्शन की पोटेंशियल हो, और आप उसको एक कह दें कि आप डिप्रेस्ड हो और वो दवाई जाके लेना शुरू कर दे, तो उसकी एडिक्शन की तरफ अगर उसकी टेंडेंसी हो, उसकी हिस्ट्री हो सकता है, इसके बारे में आपको नहीं पता, तो who is responsible for all of that? So this field is such, and the psyche, like the mind, is as complicated as the body. So it's almost like अगर आप एक डॉक्टर के पास जाएं और आप कहें कि जी मुझे गले में दर्द है, मुझे ये, और वो आपको कहते कि बुखार के साथ आपको 3 चीज़ें और हैं, और बगैर किसी उसको किए बगैर आपको दे दे दवाई, एंड वो ये भी ना आपसे पूछे कि आपको गैस्ट्रिक इशू है कि नहीं, तो हु इज़ रिस्पॉन्सिबल फॉर दैट?
राइट, वो ऐसे
आई मीन द कंप्लीट पिक्चर, यू डोंट हैव द कंप्लीट पिक्चर, सो डोंट मेक दिस बिग स्टेटमेंट्स विदाउट एनी नॉलेज व्हाटसोएवर.
या एंड आई थिंक वो ये होता भी था ना, लोग एक दूसरे को जो फिजिकल हेल्थ में भी ये होता था, लोग एक दूसरे को रैंडम दवाइयाँ और मशवरे सजेस्ट कर देते थे, जबकि यू डोंट नो द फुल पिक्चर. अगेन टेस्ट हुए भी नहीं है, वो नहीं हुआ, हाँ मुझे भी ऐसे होता था तो तुम यूँ कर लो.
और देखो इसमें एक बहुत इंपॉर्टेंट पॉइंट है, आप नोटिस करो कि हम थेरेपिस्ट क्लाइंट का वर्ड यूज़ करते हैं, वी डोंट से द वर्ड पेशेंट. सो जब ये थेरेपी का फील्ड इवॉल्व हुआ है, उसमें ये पर्टिकुलरली ये डिमार्केशन इसलिए की गई कि आपने नॉन डायग्नोस्टिक होना है, आपने नॉन जजमेंटल होना है, और आपने शेम दूर करनी है इस चीज़ से. सो हम क्लाइंट का वर्ड यूज़ करते हैं. तो जब हम ये लूजली, कैरलेसली और केयरलेसली डायग्नोसिस करेंगे, तो आप एक्चुअली उस शेम को, जैसे आपने भी कहा, वो दोबारा रीइंफोर्स कर रहे हैं.
I think it's kind of like I think you're like, so there's like, there are physical trainers out there, right, who are making sure that you're physically fit. They call their people they're working with clients, right? And then there are psychiatrists who are working with mental health patients, so they call them patients. Usi tarah there are psychiatrists who are dealing with mental health, and then there are doctors who are dealing with physical health, but then there are physical trainers who are also dealing with physical health, but they call them clients. So there's that sort of difference, I guess.
And it's very important, right? Because in how you receive it, what kind of, and therapy is all about non-judgment and openness. And to be honest, my work, 90% of my work is to become that voice that blocks the shame that my client is carrying.
Right, and I feel like where there are labels, there will be shame. So I think the less labels there are, the less sort of shame will be present, right? And with all these words going around, I think they're inducing a lot of shame.
I mean, these are all these buzzwords. अब आप देखो कितना commonly आप सुनते हैं, हाँ यार मुझे बहुत OCD है. अब OCD is obsessive compulsive disorder, and just because you're washing your hands or you're a cleanliness freak doesn't mean that you have OCD. It is possible, but that doesn't confirm it, right? And again, you need a diagnostic, sort of research into it, a search into it before you can say कि आपको obsessive compulsive disorder है. तो हमने बहुत सी, हमारी I think language भी change होगी over the years. तो हमने अपनी language में serious mental health conditions को insert कर दिया है. Sadness is not clinical depression. Whereas we'll say मैं बहुत डिप्रेस हो रही हूँ, जमील से समोसे और जलेबी खाऊंगी तो डिप्रेशन मेरा ठीक हो जाएगा. अगर वो डिप्रेशन है तो वो जमील के समोसे खाने से नहीं जाएगा. But of course you might be feeling very sad, and food is comfort, of course. So
and I think it's like it's shaming. It might induce shame in others, and it might induce sort of shame, and also making yourself a continuous victim, right? So if you don't really have the correct diagnosis, but you've sort of self-diagnosed that you have something, then what you're essentially is doing is that you're preventing yourself from helping yourself, because you have this victim mentality कि ओ मुझे तो ये मसला है. right? So
बिल्कुल आई थिंक
I can't be changed because I have this problem.
क्योंकि देखो there's a conflict in each one of us. हमारी कोई भी जब आपका attitude towards mental health हमारे अंदर, for example अगर आपने victim की बात की, I think एक inborn resilience हम सब में है. So not everybody lands in therapy to change and grow. People change because of some experience they've had that allows that internal resource or that internal resilience to get activated. जिन लोगों की नहीं होती, उनके therapist becomes that person that says look, you have it and you need to access it. So वो चीज़ भी कहीं ना कहीं हम we get stuck sometimes. For example अगर मेरे पास कई clients 6 साल से आ रहे हैं और अगर वो मेरे से पूछें तो मैं कहूँगी कि हाँ, maybe you can keep the door open but you might not need to come because sometimes too much therapy can become counterproductive as well. कि मैंने अगर हर हफ्ते सेशन में जाना है तो फिर मेरे पास कोई बात करने के लिए हो, और आपकी ज़िंदगी में उस वक्त ऐसा कुछ भी ना हो मसला, आप कहीं ना कहीं मसला निकालेंगे भी, क्योंकि आपका एक पार्ट को, I mean, we all had that habit. We do want to get that kind of attention to make up for so much that we've been through, or even if it's little, it's human nature as well to get that kind of attention, right? So yeah, these terms और थोड़ा एक amplification, थोड़ी exaggeration into our symptoms बिल्कुल होती है, जिसकी वजह से आप फिर एक victim mentality में भी हो जाते हैं stuck. It's like a jail-free card to just be however you want to, and again you're not taking personal responsibility then.
And why do you think this has happened? Do you think mostly this is because of social media? Because I feel like there's a lot, it's that वही बात है कि people had the right intentions to create awareness, right? But it's not being done very responsibly.
I think I like how you worded it कि intention बिल्कुल है. देखो एक overall अगर आप पाकिस्तान में जो education system है, कहने को जो literacy rate है उसमें से majority किस तरह के schools और colleges में जा रही है, जिसके अंदर आप government schools की जो horror stories आप social media पे सुन रही हैं, या I don't want to name any colleges but I do know कि most colleges do not have really good education, right? Social media has become a way to educate people as well, and so all this young generation, I like that they have the drive to, मतलब अगर वो pop psychology के भी 2 मिनट निकाल के पढ़ रहे हैं तो वो पढ़ तो रहे हैं, curiosity तो है, लेकिन इसमें थोड़ी सी एक पाकिस्तानी mentality भी आ जाती है जो मैं I would say कि हम बहुत जल्दी expert बन जाते हैं और हमें मशवरा देने का बहुत शौक है, तो हम फिर वो 4-5 psychologists की posts पढ़ने के बाद हम experts बन जाते हैं. Now we want to start sharing it with others. So yes, social media definitely is great. It's like a quick fix solution to mental health, to physical health, to let's just order फलाना oil और ये मसला ठीक हो जाएगा. So हमारे अंदर वो जो एक impatience है, जो एक lack of containment है, जो आपको हर रोज़ नज़र आती है अपनी daily interaction में भी, कि हमारे as a society unfortunately I feel we're really regressing. Economics को तो आप पीछे रखते हैं, moral decline है, patience नहीं है. Just the other day I was telling my friend कि I stopped the car for this family to pass by on the road, और उनकी शक्ल पे इतना ग्रेटिट्यूड था क्योंकि वो ये भी नहीं एक्सपेक्ट कर रहे थे कि वो बच्चों के साथ कोई गाड़ी उनके लिए रुकेगी. तो ये तो हमारे हालात हैं. तो इस तरह के माहौल में जिसके अंदर इतनी फ्रस्ट्रेशन है, कलेक्टिवली वी आर जस्ट गोइंग थ्रू सो मच ऑफ उसमें फिर आप जब ये मेडिकल और ये मेंटल हेल्थ की टर्म्स को इंसर्ट करते हैं और लोगों को लेबल करते हैं, तो ये तो डेंजरस इज हाउ आई सी इट.
या सो I'll add something to that as somebody who has been on social media for so long, on the creator side, has been using these platforms to talk about stuff. So I personally feel like one of the reasons why, and not just about mental health, about anything, putting information about anything out there is slightly dangerous because we've really moved to short-term content, which short-form content, which I have a huge problem with because it lacks context. It's just putting things out there, fitting it in 1 minute, and just having people consume it, and obviously it lacks context, it lacks complete information, and what we're doing is that we're just going through so many posts in a day and just taking what we can from them, but they lack depth, they lack substance, they lack context, which is so essential. So we're all learning things but we're not learning them fully. It's exactly. Like हर चीज़ हम incomplete learn कर रहे हैं. We're learning these little tips about this and about that, and we're applying those in our life, which is why I personally feel, but I also do podcasts which are like 1 hour long or 1.5 hour long, because I feel it's so important to explore topics in more depth, right? And वही बात है, people are just lacking so much patience that they just want a quick fix and a shortcut to everything.
मतलब in all honesty, like in the introduction you said, you've invited me because people like what I say. The only reason I keep coming back is because you are perhaps the first person in this field who I have been exposed to, जिसमें इतनी जिम्मेदारी है कि अगर मैंने भी आपको कॉलम अपना कहा है कि आप पढ़ लें तो आपने पढ़ा है. I used to go on TV to a couple of channels and I partially stopped going because literally there was no research. और इस तरह के क्वेश्चंस मेंटल हेल्थ को लेके होते थे कि मुझे डर ये लगता था कि अगर ये जो होस्ट हैं ये जिस तरह के सवाल कर रहे हैं. अभी रिसेंटली आई वेंट समवेयर एंड आई वाज जस्ट लाइक ओ गॉड आई एम नॉट कमिंग हियर अगेन, बिकॉज वही वाली बात है कि आप सवाल कैसे कर रहे हैं और आप क्या ऑडियंस को, अपनी मिलियन ऑफ ऑडियंस को आप बता रहे हैं और कोई सेंस ऑफ जिम्मेदारी नहीं है. दे कम इन द मेकअप रूम, दे डोंट केयर, दे टेक अ मिनट टू jot down a few questions. So I can expect them from a layman, but not somebody who has that kind of viewerships. And you have that, understanding and sense of responsibility, which is just amazing.
Yeah, I've had my own bit of experience with TV because when, I was one of the first people who started using social media for content creation. So, I used to get invited all the time to talk about अच्छा content creation क्या होती है और ये क्या होता है and stuff like that. तो तब ये होता था, तब भी like the conversations felt so mindless because it would just be like कि सवाल क्या है और मैं जवाब क्या दे रही हूँ और उसमें रिस्पॉन्स क्या है.
और आप इतने बड़े बड़े सवाल, जैसे अभी मुझे किसी ने कपल थेरेपी को लेके, तो आप ऐसी एक क्या बात है जो आपके ख्याल में बीवी को ऐसा एक क्या कर सकती है जिससे सारे मसले ठीक हो गए. And I was like, I was wanted to pull my hair out कि इतना बड़ा सवाल एक रिलेशनशिप में क्या मतलब, how do you even answer that?
Right, exactly.
And I walked out on live shows because of this, and nobody invites me now because it's a sense of responsibility, and I can't जितनी भी knowledge है अल्लाह ताला उसको बढ़ाता रहे. It's because I sit across a person for 50 minutes to an hour, and what goes on in people's mind, the struggles they have. I mean, it's like I really experienced that pain at a very close distance. तो उसके बाद तो it makes me very angry, to be honest. इसलिए it's like an appeal to the new generation, to be honest. That show, you guys are excited. I love that. Please take some time out and read more than a few posts. And if you're not into reading and you don't want to research, that's fine as well. Then let the professionals make those diagnoses and make those statements. आप अपनी लैंग्वेज को एटलीस्ट नोटिस कर सकते हैं कि अगर आपका एक फ्रेंड एरोगेंट है, सो एरोगेंस इज समथिंग एल्स. डोंट पुट देम हर और हिम इन अ बॉक्स ऑफ तुम बहुत नार्सिस्टिक हो. नहीं, वो एरोगेंट है, वो नार्सिस्टिक ज़रूरी नहीं कि हो.
I think and I feel like people can share their experiences or their thoughts and opinions, but people share things like their facts, which is I think more dangerous.
That's a Pakistani thing, to be honest.
No, I mean, I don't agree entirely because there's lots of posts and stuff out there that
maybe
that a lot of people are putting online. Pakistan में तो I guess generally हमारा problem है हर किसी को बताने का हर चीज़ का, but I think and the I think people just sort of fail to understand that everybody has had such a different life experience that what applies to you may not apply to them. So it's not, you can't, it's not a one size fits all kind of a situation.
The reason why I'm in Pakistan, there's no lack of love for the country, लेकिन we have to call out the reason.
The problems,
देखो यहाँ इसलिए ये ज़्यादा गैर जिम्मेदारी है because मेरी जैसे my supervisor is a Britisher. I'm in one or two groups where I work with people who are in, so I'm like, for example, there's a peer supervision group where all the psychotherapists, they all like Oxford based are, उनका मेरा से 15 साल ज़्यादा एक्सपीरियंस है, लेकिन वो सवाल ज़्यादा करते हैं और स्टेटमेंट्स कम देते हैं. और उसकी वजह ये हमारा में क्यों पाकिस्तान बाबा कहती हूँ अकाउंटेबिलिटी नहीं है. यहाँ मेंटल हेल्थ ही रेगुलेटेड नहीं है. एनीबडी कैन से आई एम अ थेरेपिस्ट एंड दे कैन ओपन शॉप इन द हाउस एंड सो फॉर एग्जाम्पल आई नो मेरी ट्रेनिंग क्या है, लेकिन मुझे आज तक, मैंने आपको पहले भी कहा है कि हार्डली कभी किसी ने पूछा है कि मेरी कोई एक्रेडिटेशन है कि नहीं, मैं सुपरविजन में हूँ कि नहीं, मेरी डिग्री मैंने दीवार पर लटकाई है, ये कोई इसकी वैल्यू है भी कि नहीं. तो यहाँ क्योंकि लैक ऑफ अकाउंटेबिलिटी है, इसलिए हमारी रिस्पॉन्सिबिलिटी कम है. हमें किसी का डर ही नहीं, हमें किसने पूछना है.
सही बात है. इट्स जस्ट, और वो हर चीज़ में,
और इंसान अकाउंटेबिलिटी के बगैर नहीं चलता ना. हम पहले वही बात कर रहे थे कि फिजिकल हेल्थ के लिए भी ट्रेनर हो और अकाउंटेबिलिटी हो, तो फिर आप उसमें नहीं करते हैं.
देन वी पर सीधा रहते हैं आप.
बिल्कुल. वो ह्यूमन नेचर है. वो इज नॉट ओनली टू स्पेसिफिक टू माई कंट्री और टू एनी अदर कंट्री.
ओके, सो there's one thing I wanted to ask you, and you can elaborate as much as you want. I mean, I don't expect you to just put it in one line or something, but what is considered to be a good state of mental health? So is it having uh, um, having good emotional regulation? Is it having a calm nervous system, or is it being able to live in the present, have more mindfulness? Is it all of these things? What makes a good mental health? Like, I can say, okay, I think I'm in a good place mentally. What does that mean?
So I think it's all of this. Of course, this is important कि आपका nervous system regulated है, आपके emotions regulated हैं, और emotional regulation का मतलब ये नहीं कि आपको गुस्सा नहीं आ सकता या आपका रोने को दिल नहीं करता, लेकिन आप constant एक flux में नहीं है. ऐसे नहीं कि every second day you're having breakdowns. So I think very simply put, for me, good mental health means कि first of all, no matter what my situation is, I'm quite aware of what the situation is, and I can make a choice in my head. So for example, I'm less blinded by my emotions, and I'm more consciously aware of my surroundings. So for example, if there's a person who is unhappily married but is choosing to stay because of the social context, जो भी उसकी वजह है, वो एक चॉइस है, और उस चॉइस पे उसने अपने पे काम करके उस जगह पे वो आई है. अब उसमें इवन इफ शी इज़ अपसेट एंड शी इज़ क्राइंग, शी इज़ अवेयर ऑफ इट. इट्स नॉट लाइक अ ब्लाइंड ब्रेक डाउन जिसमें आप अपने इमोशंस में डूबे हुए और उसमें आपको ना ये होश है कि आप खा क्या रहे हैं, आप ज़िंदगी में करना क्या चाह रहे हैं. आपका एक डार्कनेस है जिसके अंदर जिसने आपको ड्राउन किया हुआ है. सो फॉर एग्जाम्पल, इफ आई हैव दैट अवेयरनेस एंड आई एम फीलिंग लो, आई एम इन टच विद माई फीलिंग एंड आई गिव माई सेल्फ परमिशन टू ग्रीव फॉर व्हाटएवर, बट आई एम नॉट, आई थिंक मेन थिंग इज कि emotions don't take like, they don't sort of, you're not hostage to your emotions.
Yeah.
Because जैसे एक दफ़ा हमने पहले nervous system की बात की थी ना कि we have the thinking mind and we have the emotional mind. So it's not that the emotional mind is activated all the time. So I know where I am and I'm consciously aware of who I am. For example, I'm also aware of my shortcomings. I know of my blind spots. So whatever your life choices might be and whatever your circumstances, a good mental health is heightened self-awareness and awareness of others. For example, I am aware of my spouse having abusive issues or having whatever, and so when I'm sitting there and even if he's screaming in my head, I know that I'm choosing to accept it, and I know this moment will pass. एंड श्योर मेरे पे इम्पैक्ट है, लेकिन वो मुझे इतना नहीं डाउन कर रहा कि मैं बिल्कुल ज़िंदगी में रुक जाऊँ. सो वी लर्न टू डील विद अदर्स, वी लर्न टू डील विद आवर ओन इमोशंस इन अ मोर रेगुलेटेड एंड विद अ लॉट ऑफ अवेयरनेस.
Yeah, and I think awareness around your feelings, like what am I feeling in this moment?
Exactly, emotions.
I think people don't even, a lot of times people don't even know this.
Yeah, feelings and even your body, noticing a body. For example, good mental health again would be if I know I'm getting triggered, I can choose to respond and not react.
Yeah.
So if I'm not mentally healthy and if somebody triggers me, मुझे ये नहीं पता मेरा ट्रिगर आ कहाँ से रहा है. मेरी हिस्ट्री इस वक्त आ रही है, इस वक्त कहीं ना कहीं मैं अपने स्पाउस में अपने अब्यूसिव फादर को या अपने कंट्रोलिंग फादर को देख रही हूँ. सो मोस्टली जो लोग जिनको मेंटली अनहेल्दी मैं कहूँगी, साउंड्स लाइक अ बिग टर्म, बट जो ब्लाइंडली जिंदगी गुजार रहे हैं.
Right. So there's mindlessness there, and there's a lack of self-awareness.
You don't know your history, you don't know about your traumas, and you don't know how your past comes in your present. So somebody who's mentally healthy, for example, me sitting right now, like remember the first time that we had a session and I said this is too close.
Yeah, I remember.
So I was aware of why is this too much in my face. So someone else might have had a panic attack, might have not been able to explain. So वहाँ mental health पे काम करने की ज़रूरत है.
Understanding your triggers and understanding
and
what
how to
you're
cope
feeling,
with them, how to respond.
I think this ability to sort of identify, to also to be able to pause and respond.
Yes.
With calm nervous system rather than react on the surface, you know.
It's about choice. बहुत दफ़ा थेरेपी के जब मतलब जो है ना, वो बेसिकली है कि आई हैव अ चॉइस. ट्रिगर्स जिंदगी में देखो आएंगे. कभी भी कंप्लीट हीलिंग इज़ अ फैंटेसी. वी कांट एवर कम्प्लीटली हील. हमारी हिस्ट्री आती है, कई दफ़ा ज़ोर से एकदम आती है हमारे सामने और हम रिएक्ट भी कर जाते हैं. दैट्स ओके, अवेयरनेस के बावजूद. कई दफ़ा इट्स लाइक अ साइलेंट सॉन्ग विच इज़ प्लेइंग एट द बैक ऑफ योर हेड, बट बिकम्स अ चॉइस. सो अगैन समबडी हु इज़ मेंटली अवेयर नोज कि मैं इस वक्त मैंने रिएक्ट किया है, लेकिन मैं रिस्पॉन्ड भी कर सकती हूँ. So
one thing I learned with therapy was that a lot of times we don't even know. So a lot of times we recognize our traumas, very apparent things that we've been through. Okay, so I went through the loss of my father. I had some, you know, some things that I knew, okay, these are very apparent. I know this happened to me and these are places that I require healing. But with therapy, I realized that a lot of times we don't even know our traumas. And it is when we explore therapy, we realize, okay, this was a pain point. I had no idea this was still a pain point. Like I realized that I actually never recovered from my grandmother's loss. And I never even used to think about it. I used to think, okay, that also happened, but it just happened somewhere. And,
Bilkul.
but I realized, okay, that's still such a big wound
Bilkul.
that needed attention.
Yes.
I lost my cat quite a few years ago. But I never gave, even though I cried a lot at that time, but I didn't fully
process it.
And
see, there's a myth over here कि जी आप अगर जो थेरेपिस्ट को लेके होती है कि जैसे वो गड़े मुर्दे उखेड़ते हैं, अगर ज़रूरत नहीं है, फॉर एग्जाम्पल अगर रोड हो के एक बंदा आगे निकल गया तो फिर आपने उसके बारे में बात क्यों करनी है. ये मिथ इसलिए क्योंकि एक अच्छा प्रोफेशनल थेरेपिस्ट कभी भी आपको जानबूझ के आपकी ज़ख्म को नहीं उखेड़ेगा, ना वो आपको उस जगह पे स्टक रखेगा. सो फॉर एग्जाम्पल इफ़ यू एज माई क्लाइंट I feel कि somewhere that loss, and how do you know it's not processed? Because it comes up in your present life. If you think and talk about it and your eyes are tearing up or your body is feeling something, it means there is some unfinished business. And when it is regulated and processed, even you will not feel like talking about it, and therapist is not going to keep you in that position. कि आप बेवजह एक बात को जैसे बार बार बहुत दफ़े ऐसे बाय द वे ट्रॉमास होते हैं जो इंसान प्रोसेस हेल्प के बगैर भी कर लेता है, तो उसको जाके हम अटेंशन नहीं देंगे, उसी को देंगे जो आपका पास्ट आपके प्रेजेंट में आ रहा है. और वो ऐसे ऐसे तरीकों में आते हैं, आपकी लाइफ चॉइसेस में आते हैं, आपकी हैबिट्स में आते हैं, जो कि आपका ब्लाइंड स्पॉट भी है और आपको नहीं पता होगा unless someone else puts light shines a light on it.
And I was like, oh my god, I have had to recover from these really small things.
कि कितनी मेमोरीज पुरानी जो हैं वो आती जब प्रोसेस स्टार्ट होता है.
Right. And it's not like somebody is sort of attacking you or pulling them out of you. It's a process that happens on its own, and you kind of realized, okay, these were some pain points that I didn't even recognize as pain points.
And see, this anymore. Is exactly, I'm really glad that you brought this up, because this is exactly why your friend cannot be your therapist. बहुत से लोग सवाल करते हैं ना, थेरेपिस्ट में बैठ के सुनना ही है. कैथारसिस इज समथिंग एल्स, कि मैं अपनी फ्रेंड को अपनी बात बताऊं, वो मेरी बात सुने, मुझे हौसला दिलाए, मुझे ड्राइव पे ले जाए. लेकिन एक मेंटल हेल्थ प्रोफेशनल इज लिटरली लाइक अ डिटेक्टिव in the room. They're making a 3D map, they're connecting the dots, they're realizing okay, maybe that loss of the cat that probably everybody thought, someone might have said January to hai, what's the big deal, how this statement has become your pain point in the shoulder that you wake up every morning. So there is a lot of mapping and jotting, and like I'm fully active and present, and literally there's a 3D map in my mind that I'm making. So I'm not just sitting and listening. Sirf catharsis nahi hota.
And I feel like when you actually notice the difference when you recover from or heal from traumas, and you haven't been able to understand, why am I not being able to do certain things in my life, because those traumas have been serving as mental barriers, and you don't even realize, and when you actually heal from them, you see the difference in your daily life, and you're like, oh, it's because I actually recovered from traumas that were my mental barriers, and I didn't even realize the connection.
And then awareness के साथ you recovered, आपने blindly नहीं recover किया.
So this was very enlightening for me कि अच्छा आपको पता भी नहीं होता the things you actually need to recover from, and that awareness leads you to having a good mental health. And what you said about having a good mental health is very interesting, so I just want to make a statement or put my thoughts out there on that. Was that people might confuse that with just being happy all the time, and not just happy but just being at peace maybe all the time, but it's actually like you will experience all kinds of emotions, but you will experience them with more awareness and understanding of them. And
it's like when people say what is mindfulness means, so just now I became more mindful because I can hear my voice right now, I can hear the tone, suddenly I'm more aware of my fingers, and this mindfulness is like you become a witness to yourself in the moment,
right?
So and that's how it is for mental health as well, कि आप in a way you zoom out, and now again I became more mindful because अब दोबारा से मुझे अपनी आवाज़ सुनाई दे रही जो मुझे पहले मैंने नोटिस नहीं की थी, इस वक्त मैंने की है. So mindfulness इसीलिए वो जब it's a big statement again where people think I become more mindful because I went to a yoga retreat. It's a struggle because we are mostly mindlessly, organically, spontaneously हम जिंदगी गुजारते हैं भरोसे पे, अल्लाह पे, इंसानों पे, and that works most of the time, right? So mental health is about mindfulness of our traumas and triggers in our life. इट डजंट नेसेसरली मीन मेंटल हेल्थ का ये मतलब नहीं है कि आपके ब्रेकडाउन्स नहीं होंगे, आपको रोना नहीं आएगा, आपकी ज़िंदगी बहुत कोई अमेजिंग हो जाएगी. कई बार मुश्किल में भी आपका लेंस और पर्सपेक्टिव थोड़ा सा इस लाइक आपका दिमाग खुल जाता है और आपको पता है आपके साथ हो क्या रहा है. और अगर आप कंपैशन के साथ, काइंडनेस के साथ अपने आप को ट्रीट करें, देन ऑफ कोर्स यू आर मोर मेंटली हेल्दी.
And I think that's a very big part of it as well. When you're mentally healthy, even if you recognize a lot of negative emotions inside of you, you can treat yourself with compassion.
Yes, yeah. So all these layers are there when it comes to mental health.
Yeah, because I feel like even if a lot of people, they do see those emotions inside of them, so it could be any kind of jealousy or hatred or envy or anger,
which is valid, all of it.
Yeah, which is valid, but they will experience them, but they will also shame themselves for having those feelings.
Like I said, my biggest work is that I am that voice that blocks the shame when my clients come for therapy. And I have to become that voice more often than not, consistently for years at end times. बिकॉज वो इतनी इंटरजनरेशनल इंग्रेंड है बॉडी माइंड सिस्टम में वो शेम के उसको, इसीलिए जो हम जिस टॉपिक एंड आई वांटेड टू टॉक अबाउट इट कि ये जो गैर जिम्मेदारी के साथ हम मेंटल हेल्थ की बात कर रहे हैं, उस शेम को हम दोबारा से रीवूंडिंग कर रहे हैं. सो और पाकिस्तान इट्स अ वेरी ब्यूटिफुल टाइम इन अ वे एज फार एज द अवेयरनेस एंड क्यूरोसिटी अबाउट मेंटल हेल्थ इज़ कंसर्न. आई स्टार्टेड इन 2018. अब मैं जब देखती हूँ कि रोज़ में कितने लोग कॉल कर रहे हैं, रीच आउट कर रहे हैं, इट्स वेरी इंकरेजिंग. So it's important that we are responsible during this time and encourage and have conversations about it. जैसे मैंने कॉल में भी लिखा था, अपनी बात करें, अपना एक्सपीरियंस शेयर करें, एक्सपर्ट ना बने, 4 सेशंस देख के थेरेपिस्ट ना बने.
Yeah, that's true. You said that you try to eliminate shame when it comes to your clients. A lot of people used to say कि therapists जो हैं वो validate कर देते हैं and they basically लोगों के बुरे actions से उनकी guilt हटा देते हैं, right? And वो यही है कि अच्छा, if you're removing that shame, do you think that is encouraging people to continue that behavior, or removing that shame actually helps them change?
इंटरेस्टिंग क्वेश्चन. सी शेम रिमूव करने का मतलब ये नहीं कि आप पर्सनल रिस्पॉन्सिबिलिटी से डिस्करेज करें या आप अकाउंटेबिलिटी से डिस्करेज करें, लेकिन शेम कभी काम कर ही नहीं सकती इंसान जब तक इंसान थ्राइव वैलिडेशन और इंकरेजमेंट पे करता है. सो फॉर एग्जाम्पल, आई वर्क विद क्वाइट अ फ्यू मैन हु आर अब्यूसिव टुवर्ड्स देयर वाइफ्स. नाउ व्हाट वुड रिमूविंग दैट शेम मीन? इफ आई गिव यू एग्जाम्पल ऑफ इट, सो व्हेन दैट पर्सन कम्स, आई विल सेपरेट द बिहेवियर फ्रॉम द पर्सन, मीनिंग what you do is wrong and I absolutely don't endorse it. There is no justification for it. The narrative, she made me do it, it's utter BS. So उस पे बहुत एक loud voice करने में होती है जो मेरी होती है कि as a woman sitting over here, this is something which is not okay under any circumstances. Having said that, this doesn't define all of you. And most importantly, when you as a man in this patriarchal society, इतनी misogyny इधर, एक फीमेल थेरेपिस्ट के सामने आप बैठ के अपने पे काम करना चाह रहे हैं, तो hats off to you for that. And so I will, so there is like a balance where I'm saying what you do is wrong, but that doesn't mean that you're a bad person.
Right, it doesn't define you. And I think that's so important because when you're telling them that, it's putting in them in this thought that they have the ability to change.
Of course.
Because if you're going to label them, then it's like, okay, this is who I am. I'm not going to change.
गिल्ट और शेम आपने कहाँ से रिमूव करनी है? आपके पास एडल्ट क्लाइंट्स आ रहे हैं जिनकी सेक्सुअल अब्यूज हिस्ट्री एज अ चाइल्ड एंड दे हैव बिकम द होस्ट फॉर दैट शेम एंड गिल्ट दैट बिलोंग्स टू द अब्यूजर. सो आपने वो सेपरेट करनी है कि जस्ट बिकॉज यू डिड नॉट टेल एनीबडी, दैट डजंट मीन दैट. हैविंग सेड दैट, आई ऑल्सो वर्क विद 1 or 2 people who were the abusers. So who actually were people who had sexually abused children. अब वो again बहुत मुश्किल एक thin line थी between saying okay, let's figure out and how I remove the shame is by this one statement I very often make is you were not born this way. So now let's look at the system that you were born in that created this part of you that is so dysfunctional, that is so unhealthy कि आपकी जैसे वो रूमी की कोट है कि आपका wound क्योंकि heal नहीं हुआ तो उसका blood दूसरे लोगों पे spill हो रहा है. लेकिन अगर मैं सिर्फ शर्मिंदा ही करती रहूँगी तो मैं कहीं भी एज अ थेरेपिस्ट ये मैसेज बिल्कुल नहीं दूंगी कि आप का justified है. Just because your father abused you or you were sexually abused by your Qari Saab, now that turned you into that person who was abusing children. Yes, there is that link, and that somehow normalize it for you, and that is your way of feeling yourself, but that doesn't mean that you are this person for the rest of your life. And unless you encourage that, how will they change?
Yeah, exactly. Like, not shaming doesn't mean that you're justifying the behavior or encouraging the behavior. You're just you're sort of, you're tending to that part of them that needs to hear that you can change. And if you're going to be shaming them, you're essentially saying you can't.
देखो, दूसरी बात ये है कि मैं, I mean, I'm a spiritual person. मैं तो like maybe I shared it before, since a few months I've been reading Quran, and I just find amazing how psychology is so much. हमारी रिलीजन में साइकोलॉजी किस तरह है. तो आप मतलब कितनी दफ़ा आप सुनते हैं, अब तुम तो ये करते हो वो करते हो, नमाज़ पढ़ने का क्या फ़ायदा. तो अल्लाह ताला ने आप कुरान में आप जिस मर्जी, इट्स ऑल अबाउट forgiveness over and over again. So what is that? That is blocking the shame. So that's the devil, and that all that darkness that says तुम तो हो ही अंधेरे में, तो अंधेरे में रहो. तो लाइट की तरफ ले जाना, तो हमारा तो पूरा रिलीजन इस चीज़ से बेस्ड है, जिसमें हमें कहा जाता है बार बार माफ़ी मांगो, 10 दफ़ा मांगो, 10 दफ़ा माफ़ी दूंगा. मैं इंतज़ार कर रहा हूँ कि मेरे से माफ़ी मांगो. सो इसलिए थेरेपिस्ट भी उसी चीज़ को कहीं ना कहीं हम रिक्रिएट करते हैं, बिकॉज शेमिंग इज नॉट गोना वर्क. इफ यू ओनली जस्ट बिकॉज आपने किसी को लेबल ही कर दिया है. So why would I want to try if you tell me that I'm not good?
Right.
So I'm just going to give up on myself then.
Yeah. But then you will feel like you don't have the ability to do that. It's like वो ये कि you're saying that you can't change. When you label someone, you're essentially saying you can't change.
And I think I want to just add one more thing, because we spoke of it, कि थोड़ा सा genders को लेके, like जब मैं labeling की भी बात करी थी, कि I've noticed, मतलब मैं तो उसी population group की बात कर सकती हूँ जिनके साथ मैं काम करती हूँ. तो मेरी statement में इतनी credibility now, लेकिन मैं अपने experience की, हाँ, कि I find women to have a greater tendency to label and judge, and women demand empathy. But when it comes to offering empathy, especially towards men, I find that lacking, to be honest. Mostly, I mean, I've been working with couples more lately. When it comes to that, I find men to have more understanding and more generosity and less labeling and more empathy, contrary to women जो बैठ के कह रही होती हैं कि हमें empathy चाहिए. ये narcissistic इंसान मुझे empathy क्यों नहीं दे रहा. तो ये भी हम as women हम बहुत ज़्यादा अपने rights की बात करती हैं, लेकिन थोड़ा सा हमें भी अपने अंदर झांकने की ज़रूरत है कि हमारे में tendency ज़्यादा है जज और लेबल करने की.
Yeah, and I think if we want to see change, we might have to do it more compassionately.
Yes.
I think that has more chances of bringing the change.
I've noticed that in women more than men, to be honest, and I wanted to call it out कि ये है शर्मिंदा करना. इसीलिए बहुत दफ़ा, जैसे फॉर एग्जाम्पल अगर इनफिडेलिटी के भी आ रहे हैं, तो मैं एक काम जो हमेशा करती हूँ, अब्यूज़ होगी, ओके लेट्स पुट दिस आउटसाइड द रूम फॉर नाउ, और अब देखें कि सिस्टम में क्या है. और इसमें मैं ब्लेम की बात नहीं कर रही जी, मैं बिल्कुल अभी भी फर्मली बिलीव करती हूँ कि अ वुमन कैन नॉट मेक अ पर्सन लूज हिज टेम्पर एंड बिकम अब्यूसिव. ये उस इंसान की अपनी जिम्मेदारी है. या अगर किसी ने इनफिडेलिटी है, तो हाँ, उसकी अपनी जिम्मेदारी है. हैविंग सेड दैट, एक पूरे सिस्टम को भी देखना ज़रूरी है.
Right, it has to be done in a holistic way. Like, what are all the factors?
In a very systemic, holistic way.
What are all the factors contributing to this entire situation?
So we as a society, we हमारा, I think, and it's not something we do consciously. एक क्योस है, आई थिंक हमारे अपने दिमाग में होता है. तो हम एक बिहेवियर के ऊपर पूरे इंसान को उसी एक ब्रश के साथ, लाइक स्ट्रोक के साथ हम पेंट कर देते हैं.
I think a lot of times we're also just trying to justify our own emotions, right? Like, why we feel like this. So we're going to find the
evidence to support it.
Right, the evidence to support it, to blame someone, to put that label so that, we can.
I just hope as a society, I really, really hope, and I'm practicing it myself. More than practicing, I'm learning as well. It's not that I'm all sorted. कि we need to take more personal responsibility. हम लेंगे तो ऑटोमेटिकली अगला इंसान का बच्चा बन ही जाएगा.
है, पता है,
उम्मीद तो कर सकते हैं.
बिल्कुल. और मैं अपने पर्सनल लेवल से बताऊंगी कि when I first got married, when you get married in the start, you see things in your spouse that you want to change, right? No matter how much you love them, आपको कुछ चीज़ें होती हैं, आपको होता है कि यार, because you're not used to them, you find those out and you're like कि यार नहीं, ये आदतें बुरी हैं, ये change करो. And I saw that the more you do it with a lack of compassion or with shame or with like, like if you do it with shame to the other person कि यार आप इस तरह क्यों कर रहे हो, या ये गलत है, या आप तो हो ही ऐसे, right? You're so lazy or you're so this or that. It doesn't work. But when you do it with more compassion, with a more supportive attitude, it actually works.
बिल्कुल, बिकॉज ही उसमें रेजिस्टेंस बढ़ती है. आप जो बात करिए आपका, इसीलिए इवन विद माई क्लाइंट्स आई रियली हैव टू टिप टू अराउंड दिस थिंग इवन इन द फर्स्ट सेशन. मोस्टली ऑब्वियसली पता चल जाता है कि ये चीज़ ये है, थोड़ा बहुत आपको अंडरस्टैंडिंग होती है, बट आई एम नॉट गोइंग टू मेक दोज बिग स्टेटमेंट्स इन द फर्स्ट फ्यू सेशंस एट ऑल, बिकॉज इन अ वे वी ट्राई टू क्रिएट एन एनवायरनमेंट वेयर दैट पर्सन अराइज ऑन दैट कंक्लूजन ऑफ themselves on their own. हर इंसान अपने बारे में खुद जानना चाहता है, वो किसी से प्रोफेशनल से भी सुनने की हिम्मत नहीं होती. मैं यहाँ बैठ के आपको अगर अभी आप दो तीन आपकी ऑब्जर्वेशंस अपनी शेयर कर दूँ, आई नोन यू फॉर सम टाइम, यू नॉट गोइंग टू लाइक इट.
and I will actually want to डिस्टेंस कर दूँ अपने आप को.
और हो सकता है कि आपका एक पार्ट को अच्छा लगे कि अच्छा ठीक है, मुझे एक चलो फ्री में मुझे थेरेप्यूटिक एडवाइस मिल रही है, मगर वो आपकी रेजिस्टेंस को भी बढ़ाएगी. बिकॉज वाई यू नो, लाइक फॉर एग्जाम्पल आपने कहा शादी के शुरू में, जो कि बहुत सी खवातीन करती है, आई हैव डन दैट एज वेल. एवरीथिंग इज इन द कॉन्टेक्स्ट, इन द रिलेशनशिप. अगर ट्रस्ट होगा और आपस में वो बॉन्डिंग होगी तो फिर वो आप एडवाइस सुन भी लेंगे. इसीलिए थेरेप्यूटिक रिलेशनशिप में जो कहा जाता है हर हफ्ते आए, महीनों में आए, बिकॉज आप कंटिन्यूटी जब होती है तो मैं किसी एक क्लाइंट को तीसरे सेशन में बात ही नहीं कर सकती क्योंकि मेरा बॉन्ड ही नहीं है. बट 6 months के बाद मैं चैलेंज भी कर दूंगी, मैं ये भी कह सकती हूँ कि स्टॉप फीलिंग सॉरी फॉर योर सेल्फ, बट एट द एंड ऑफ द डे वी डोंट लाइक टू बी टोल्ड. And it just makes us more resistant to the process of changing and of evolving.
Right. And I think that I feel that as a parent as well, that I can't, you know, if you want to teach your child lessons, you can do it without shaming them. You don't have to, you know, make them feel bad about everything to make them learn.
And remember last time we talked about it कि बच्चों के साथ relationships में it's connection before correction. Unless you have a connection with somebody, don't correct them. So even if it's a love marriage, the first few months of a marriage where it's a totally different dynamic from dating or from being engaged, you are not connected enough to correct. So wait for that connection to form before you can come in and
tell them what to do with themselves. It's kind of, you really, I mean, it's not fair to do that to someone. True. I see that. And I do think that if you want to teach your kids anything, if you want them, you know, to do better, you need to remove harsh words and harsh statements, shameful stuff, because it's just going to make them feel bad. हम तो बहुत यूज़ करते हैं. हमारी सोसाइटी में तो बहुत ज़्यादा है. फिर पेरेंट्स का है, लेबलिंग है, कितने साल आप उसको अनडू करते रहते हैं. एंड आई थिंक हमें होता है ना कि उनको सिखाने के लिए आपको एक बड़ा सा रिएक्शन देना पड़ेगा. सो फॉर एग्जाम्पल आपके बच्चे ने कुछ तोड़ दिया, कुछ गिरा दिया, तो लाइक हो ये क्या किया आपने, जस्ट टू शो देम कि ये क्या कॉन्सिक्वेंस.
हमने पेरेंटिंग को समझा ही नहीं, जो हम सेल्फ डिसिप्लिन या हम बच्चों को डिसिप्लिन करने पे जो कि भाई हम अच्छे पेरेंट्स हैं, हमने बच्चों को डिसिप्लिन कर रहे हैं, हम डांट रहे हैं अगर कुछ गलत कर रहे हैं, वो I don't think it has really worked. Of course, it's valid. वो भी करना ज़रूरी है, लेकिन again, connect before you correct.
And do you think that when
connection to children don't come just because you're the parents, biological parents. That's something I'm learning. कि just because मेरे बच्चे हैं and I'm the biological mother, so बस उनकी मेरे से एक शदीद जो है ना मोहब्बत और love is there, but that doesn't mean that we are connected to the children. And connection takes effort and like I said, honestly, as a parent, I had to unlearn many things. When I compare my firstborn to my third, I can see कि firstborn में कुछ चीज़ों में I wasn't connected enough. I mean, I love her and I functional parent में बहुत अच्छी थी, लेकिन मेरा वो real connection नहीं था जो अब बन रहा है. और फिर जैसे मैंने उस बुक में, दिस वेरी गुड बुक बाय डॉक्टर गाबर माते जो मैंने पढ़ी थी, होल्ड ऑन टू योर किड्स, जिसमें ये सारा था, तो उन्होंने ये कहा कि हैव एन जेन्युइन नीड टू कनेक्ट. यानी आजकल बहुत से ऐसे पेरेंट्स हैं जो बच्चों को सॉकर क्लब, म्यूजिकल रिसाइटल्स, ब्ला ब्ला ब्ला, जिसमें आप उनको ओवर स्टिमुलेट कर रहे हैं और आप जेन्युइनली वांट आपकी कनेक्ट करने की नहीं. आप एक तो खैर इट्स अ गुड वे एज वेल कि बच्चा यहाँ जा रहा है वहाँ जा रहा है और 10 मिनट शायद उसके साथ बैठ के बात करना आपके लिए मुश्किल है, तो बहुत अच्छी वो एक परफेक्ट पेरेंटिंग लग रही है कि जी सॉकर क्लब के बाद अब वो पहले क्लास में हैं और उसके बाद कारी साहब आ गए हैं. लेकिन what about those 15-20 minutes of wanting to sit with a child?
I agree with you so much.
और उसमें only sit with your child if you really want to sit with your child. And if you don't want to sit with your child and connect, then figure out what's happening with you that you actually don't have a genuine need to connect. So I, as a young parent, like I was 24 when I had my firstborn, I realized I was an amazing functional mother. कि इसके ऊपर से नीचे तक कोऑर्डिनेटेड कपड़े थे, एक सफाई थी, सब था, लेकिन मेरी नीड टू कनेक्ट नहीं थी. मैं एक रोबोटिक, एक बस एक जो मेरी अंडरस्टैंडिंग थी कि एज अ मदर क्या होनी चाहिए, मैं उसमें. और अब जब छोटी है तो I don't care if she wears the oddest, weirdest clothes and goes and meets a friend.
I've actually had discussions
But
about
I like spending time, and I feel the relationship is more about us being together than me being this perfect parent जो उसको दुनिया के सामने के में जाके बहुत अच्छा बच्चा है जिसकी मैचिंग भी है, ये है, PSI में जा रही है, all that optics. So yeah, I'm learning to be a different parent now, to be honest.
I've had discussions like about this on my podcast before as well, and I think we, especially in our previous generations as well, we really confused motherhood. Actually, we didn't confuse it, but we made motherhood entirely about caregiving. So cooking for them, making sure that they're well fed, they are brushing their teeth, their hair is done, their clothes are done. You know, you're doing all the chores. You are the one changing the diapers.
और आप अपने आप को exactly इतना कामों में उलझा लिए कि आप connect ही नहीं कर रहे.
Yes, and I keep saying this, and I'm not saying I'm entirely right, but this is from my own experience. That when I didn't have help with my child, I was so exhausted by the caregiving aspect. I had nothing left in me for the connection bit. But times when I had help with caregiving, where I allowed somebody else to, you know, take over to do certain caregiving aspects, I could actually focus on connecting with my child.
आपकी bandwidth एक हद तक है ना, अगर आप सुबह से रात तक बच्चों के साथ, और देखो इसमें I do understand कि कई मदर्स के पास लिबर्टी नहीं है सपोर्ट की,
बिल्कुल
वो तो उसमें फिर आपने अपने आप को देखना है कि आप किस चीज़ को छोड़ सकते हैं. अगेन देयर सच अ प्रोफेशनल स्क्रिप्ट रनिंग ऑफ हाउ टू बी अ मदर दैट आई डोंट नो हु रोट द डैम बुक एंड इट्स बीन पास फ्रॉम वन जनरेशन टू अनदर. हमारी नानियों ने हमारी मदर्स को वो बुक दी और वो हमारे पास है. और उसमें ये है कि इवन दोज हु कैन नॉट अफोर्ड हेल्प, फॉर एग्जाम्पल, दे कैन लेट गो ऑफ सर्टन थिंग्स. सो फॉर एग्जाम्पल लाइक टुडे व्हेन आई वोक अप इन द मॉर्निंग एंड माई यंगेस्ट हैड नॉट ईटन, एज मदर बैक इन 2002 मैं सोच नहीं सकती थी कि वो 12 बजे तक मेरा बच्चा, वो उस वक्त 2 मील्स ले चुकी होती, नहा चुकी होती, और उसके बाद कोई ना कोई स्टोरी टाइम उसका चल रहा होता. बस लाइक ना खाओ, क्या फ़र्क पड़ता है, एक दिन नहीं खाऊंगी, नहीं नहाने को दिल चाह रहा 4 घंटे बाद. एंड दैट्स इम्पॉर्टेंट.
It is. That ease in that relationship is so necessary for you and the child, where you can connect beyond these chores.
And I don't shy away from saying कि my firstborn, she has मतलब she went through a stage of sort of depression, anxiety because of how I was. मेरी अपनी anxiety to be this perfect parent, she had vicariously absorbed all of it. And my youngest is like a street smart. She's a very different child. उसकी रेजिलियंस मेरी चेंज की वजह से डिफरेंट है एज कम्पेयर टू द फर्स्ट बॉर्न.
एंड आई थिंक दैट हैपन्स विद मोस्ट पेरेंट्स बिकॉज एंड मोस्ट फर्स्ट बॉर्न्स बिकॉज as first-time moms, we're so obsessive about getting it right and doing it perfectly. We do transfer that anxiety and that perfection into our firstborns. Like firstborns generally tend to be obsessed with perfection.
Absolutely.
And being so
I was
perfect.
firstborn myself, so I did what I was trained to. And I think वही बात है कि as women, in all honesty, we do have to struggle a lot. You know, just like in the morning only, my father called me up, and mashallah, he's very consistent. The only conversation he has with me was like, "Bete, these are the years that 100% your focus has to be your kids." So I said, ये तो आप मुझे पिछले 20 साल से कह रही हैं, तो which few years are you talking about? Like my eldest is 20 now, she's in college, so I'm waiting for the time because like, and literally this is like a constant fight I have with him, where I told him, you know, there's this amazing guy Donald Winnicott, he worked on child psychology a lot, and he coined the term good enough parent. He's like, मुझे नहीं पता क्या बात करी, बस 100% your focus should be kids, which means you need to be present with them all the time. How can one have a genuine connection with any other human being जिसकी आपने 24 घंटे caregiving भी करनी है, और फिर आप बैठ के आपका connect करने को दिल करे.
And I completely disagree with the fact that physical presence means mental presence.
Absolutely not.
And mental presence is so much more important.
आपके बच्चों को ये बल्कि because you like to learn, you should read more about him. And he also came up कि जी frustration कितनी important है बच्चों में, कि children need to feel frustrated to grow. बिकॉज हमारी ओवर एबिलिटी तो होगी, आगे जाके इनके जो पार्टनर स्पाउसेस हैं वो तो शायद ना दे सके, तो फिर हु इज़ गोइंग टू हाउ विल दे लर्न टू रेगुलेट बिग फीलिंग्स एंड डिफिकल्ट फीलिंग्स.
राइट.
सो ये भी एज अ पेरेंट कि अगर आपका बच्चा ही इज़ बोर्ड or he looks slow, we don't have to jump in every time.
Oh yeah.
And then I think it sort of wraps up to what we started off कि ये pop psychology है कि सारा वक्त बच्चे को जाके पूछना तुम ठीक हो तुम नहीं हो. नहीं ज़रूरी. Let them learn to be bored. Let them learn to be lazy. Let them learn to feel upset for no reason. And they don't have to share every time.
Let them learn to be by themselves.
Yes.
And I think as adults we lack that so much.
बिल्कुल,
right? The ability to be able to
और फिर हम वही बच्चे वही adults बनेंगे ना जिनको रोज का एक प्लान चाहिए होगा. They need to go out every day. Then they cannot learn to regulate with a routine that has nothing stimulating in it, right? So they need to be overstimulated all the time to feel happy.
There's no concept of, right, like with me, like I saw a lot of stuff online about activities you can do with your child, things you can do with your child, and those are great, right? And I knew someone who had kids like a year or so before me, and it was all about arranging this activity for them every day and then arranging that activity for them every day, or doing activities with kids all the time. So something is helping them with their sensory skills, something is helping with their motor skills and stuff like that. And I was not that kind of mom. I didn't do all that stuff, and sometimes I used to feel like, should I be doing that stuff? But then I realized, this was actually a recent realization only a couple of months ago, that I may have not done a lot of activities with my child. I'm a working woman. I'm not with my child all the time. But in moments that I've been with my child, I have connected with my child so wholeheartedly and so fully, without the need to be giving him things to do all the time. And that is also equivalent to the whole soccer club and my husband and I sometimes have this discussion, like, will we be putting our children in all these clubs? And we were like, okay, yeah, I guess some things are important.
एक दो बिल्कुल करने चाहिए, जैसे कहते हैं जी फिजिकल एनर्जी वो ज़रूर, लेकिन ये नहीं कि आप 50 चीज़ों में आप पूरा हफ्ता आपने एक घंटा आपने अपने बच्चों का डिज़ाइन नहीं करना. Stop designing their life.
Stop designing their life and give them time. Because if you are going to consistently design their life, you are not going to teach them the ability to think for themselves, really explore their inner selves. What are they thinking? What is their, or even have the ability to hear their own intuition or their own voice.
Because they're constantly looking outside. Now the engagement is just with the outer world all the time.
Self-awareness खत्म होती जाएगी.
बिल्कुल, inner world के साथ engagement नहीं.
And if you want them to be creative, imaginative, they need to be bored. They need to just sit with themselves and look around and be like, oh,
बिल्कुल. बहुत दफ़ा होता है, like my son माशाल्लाह 16, जैसे कल कहता है बोर्ड क्या करूँ, मैंने कहा छत को देखो. मैंने कहा as a 90s kid, that's what I did. जब दोपहर को पेरेंट लिटरली आप बस इधर से उधर देखे, आप बस, मैंने कहा we survived. And
और मुझे सोशल मीडिया पे होता है कि even as adults we need to do that now. Leave our phones, put them aside and just be bored for like even 5-10 minutes. And
there are way too many Netflix shows for us to do that. It's like I've got entire list going right now.
So अब तो मैं I'm very mindful of it कि सुबह में उठ के ना, मतलब कुछ नहीं, कोई स्क्रीन नहीं, कुछ नहीं. I sit with myself and I try to ensure कि अच्छा मुझे वो सुबह के even if it's 15 minutes, like I get those
just to wrap up on this, I think वही बात है कि unless there's empty space, how else will something significant or something interesting get filled up in it? हमारे अंदर वो empty space create कब होगी, जब या ज़िंदगी में create करेंगे तो अपने अंदर create करेंगे ना. अगर हर घंटा हमारा किसी ना किसी चीज़ के साथ filled up है, so unless that emptiness is created, and what do we want to fill with it? Ourselves. That can only happen if we are with ourselves for an hour, for 15 minutes, for 20 minutes, and our children need to learn to do the same.
And it's crazy how I actually learned all of these things from my child. So I saw कि मुझे होता था अच्छा मैं इसको कैसे entertain करूँ ना, मतलब पूरा दिन अच्छा अब क्या करें, but at his toddler stage I saw and I realized that थोड़ी देर I would struggle with अच्छा चलो मैं कोई activity कर लेती हूँ, but नहीं अच्छा, and then I would see कि थोड़ी देर हम बोर होंगे and then थोड़ी देर के बाद ना वो कुछ कर रहा होगा interesting सा, वो अपनी कोई 4 डिंकीज़ यहाँ से लेके आएगा, 2 चीज़ें यहाँ से लेगा, वो खुद ही बनाना शुरू कर देगा. And I was like, okay, that's good. This is what I want to harness in my child. The ability to think for himself.
Thodi self-sufficiency.
Creativity, independence, all of these, I think. And then I was like, okay, so I don't have to do all those things. Like, just let him be and let him, figure things out on his own as well.
Yeah.
And then I learned that for myself too. Okay, I don't need to fill up my days or be productive all the time.
All the time, yeah.
It's okay to exist.
To be lazy, to have a lazy Sunday.
Yeah. So thank you so much. Is there anything else?
No. I think it's good as always, and hopefully it will land with a few, and
I think sometimes I always end up in parenting with you.
I think and that's good, because parenting is such an important part of our society, right? It's a very, very important topic, and we can never have enough Happy Chirp podcast to talk about parenting. I think it's very important.
And I think it's mainly because of where I am myself, right? Like I'm a mother, and I
have all age groups operational at the moment, so थोड़ा उसमें experience, अपनी mistakes भी share करनी चाहिए ना, ताकि आपको learning graph आपका expand हो.
And I just feel like all my learnings, I'm just constantly reflecting on them to become a better parent. You know, I mean, obsessive bhi nahi hona chahiye, but you know, it's a thing. I do think about it, of course. Yeah. So thank you so much.
Yeah, thank you for having me. It was a pleasure as always.
Yes, and thank you for taking out the time, having these conversations. I hope to see you soon.
Inshallah.
Maybe in my Dubai studio if you ever come.
Sure.
Then do drop by.
That.
And again, we'll come up with a nice, interesting topic.
We will.
Thank you so much for tuning into this episode of Happy Chirp, again with Zara. I love to have her over. There's so much we continue to learn from her, and I do as well. Love to explore all these different topics with her. Please share your thoughts, leave your comments below. Don't forget to like, don't forget to subscribe, and I'll see you again next time. Allah Hafiz.